Hello and welcome to our webinar module series. This is the first webinar module from the Community Partner Outreach Program of 2021. And our topic today is OHP and COVID-19, and it builds on a previous module we released last year. We want to give you all a comprehensive update so that you can use this as a resource moving forward. My name is Jessica Diaz. I'm the Provider Outreach and Engagement Coordinator for the CPOP team, and I am one of your presenters today. Deanna, would you like to introduce yourself?
Sure thing. My name is Deanna Simon. I'm also a regional outreach coordinator on the community partner outreach team at OHA. And we love what we do. We're happy to be here to share information and to hear questions.
Thank you so much. So I will get us started. And our topic today is OHP and COVID-19 impacts. So we want to start by recognizing that COVID-19 has had a really major impact on all of our lives. It's changed a lot about how we do business. It's changed pieces of rules and regulation and processes. And so we want to do what we can to best support you as we all navigate this together. This module in particular is designed to provide our OHP certified community partners a high-level understanding of what changes have been made and what effects that might have on your work. So a few things we're going to go over is really confirming that Oregon has been approved by the federal government to make changes to OHP during the COVID-19 emergency period. These changes are approved for the entire time that that emergency period is in place. That timeline continues to change as the situation changes. As of January 12th, when we're talking about this, the current period is set through mid-March. This is set at a federal level, not at the state. So we will continue to let you know as things change. Depending on when you're listening to this, there may be a different emergency period timeline. So just be aware of that. We don't have a set date, but we will let you know in advance of anything changing. And we are asking that you follow the policies we're outlining here until we provide new guidance. All OHP benefit levels now include coverage for COVID-19 testing and treatment. That includes tests, doctor visits, prescription, other treatments, and those are covered in the emergency room and at any providers who bill OHP. All OHP benefit levels include COVID-19, and I want to say that again because that includes CALM, that emergency only care. It has provisions for COVID-19 testing and treatment. We also want to talk about very briefly the fact that the vaccine will be available and will be free for everyone regardless of their insurance or coverage. So in Oregon, other than perhaps a small administrative fee, all aspects of the vaccine will be free for Oregonians, including those on OHP, on CALM, on private insurance, or with no coverage whatsoever. A quick reminder that county health clinics and some other providers can also test and treat people regardless of their insurance coverage, and that there are testing and vaccine websites that OHA has set up to give you all more information if you're seeking that. A few things have changed for members, applicants, and assisters during this emergency period. We have reduced barriers to get and maintain public medical coverage during this period. That includes being able, as a community partner, to accept verbal consent remotely via a phone, to offer remote assistance for all OHP application methods, and that includes a remote signature on the application. Community partners have been given the ability to determine presumptive eligibility. OHP is not hard pending for many proofs, including most proofs of income. And for most folks, benefits will not close. And we're going to go over a few more details. So let's start with remote consent. To reiterate, consent forms are required for every client. That requirement has not changed. What has changed is that we've been given the ability to obtain consent remotely. And how you do that is you complete all sections of the consent form. You read the consent form to the applicant or member so that they are aware of everything that is on that consent form. You can write the applicant or member's name in on the signature line, and you want to write next to that something along the lines of consent was obtained via phone, consent via phone, remote consent, to clarify that you are writing it in on their behalf, but that you have followed this procedure we're outlining here. When it comes to remote consent, that must be submitted for every incidence to the processing center, to that Oregon.benefits email. So whether or not you would have, outside of the emergency period, submitted a consent form for a case, you should always consent it if it is a remote verbal consent. Eligibility workers should be treating these documents exactly the same as they would any other consent form. They should be honoring it in exactly the same way. So moving past consent, which is step one, going on to the remote application assistance, you are able now to provide assistance fully via phone or other virtual means. We want to make sure we honor that physical distancing and give you all opportunities to keep as safe as you can. Remote signature can be collected on the applicant portal, on the paper application via the PDF, or even phone with a one eligibility worker. So those are all of the methods to do a full application. And just we want to really connect those dots on if you are having a remote consent form that is associated with a case, you always have to send that in to the one customer service center. So every single incidence of remote application assistance, every single incidence of remote consent. And that's a CMS guideline. So a few more details on signing that application remotely. So before signing on behalf of an applicant, and to be honest, anytime you are helping someone with an application, ensure that the applicant is able to review the sign and submit section of the 7210 application. Those rights and responsibilities are incredibly important. We want to make sure that folks understand what they are signing and the responsibilities and those rights that they have by doing so. The sign and submit section, you can send it to folks. We just want to really make sure we are doing our due diligence and people have everything they need to understand what they are signing. It's especially important when this is done remotely and you can't sit down with someone to really go over it. Of course, consent forms are still required. I know this sounds redundant, but we really want to make sure we are being very clear about this. We can use the remote consent signature process when we are signing the application remotely. Those work together in tandem. And then we do need to submit it for every incidence of remote application assistance. So how exactly do you sign a PDF or paper application remotely? We have some guidance here to help you all. So if you open up the PDF application, it is now the 7210. It is fillable, which includes a signature section on that signature page. We're asking that you type in the primary applicant's full name where it says printed name. Where it says signature, we want your name and your community partner organization. And then we need today's date. So the smart signature that is built into this form is a little tricky. So we've given you some guidance. Once you click it, and then it'll open up the signature tool. We want you to put your name as the community partner and your organization in that first name field, just so we know that when it does print it out into the application, we'll see the primary applicant's name, we'll see your name and your CP organization, and that way we know that it was signed remotely. This is a little weedy, but this will help you have success if you are helping folks through the PDF application. And then if you're doing a paper application, we ask that you print in the primary applicant's full name into printed name, and then put your name and your CP organization into the signature as a way to show that you helped someone remotely with their signature on the application. You also want to take a moment to revisit presumptive eligibility, which is something that non-hospitals community partners now have access to for the first time. You'll see us use PE as the acronym for presumptive eligibility. So this has historically been a hospital tool that offers temporary but immediate OHP coverage based on a short form instead of the full application. In order to use this tool, you must first verify with your organization that this is an appropriate role for you. You must complete the self-serve online training, and there is also an exam that you must pass. And all of those pieces are available at this short URL. It's bit.ly/OHP-HPE. And it has all of the materials you need to fully complete the training, take the exam, all the materials you will then need once you are able to do presumptive eligibility, the various forms and documents you'll need. They're all there. And just a quick review of what that looks like on the website. If you click to the website, you will find an opportunity to specify that you are a community partner. And then there is just over 30 minutes of training. It's a very short, very to the point training, and then a quiz that you must take. I do want to take a second, I know I've clicked ahead, but to say that if you are affiliated with a hospital and your hospital has an HPE process, you should still continue to use the HPE process. The new presumptive eligibility process is only for folks who previously were unable to do presumptive eligibility through their organization. Moving ahead, what has changed for members? So we have a lot in place to make sure that folks do not lose coverage during this pandemic. That means that most OHP members will not lose their coverage for any reason other than the ones listed on this slide. So they must either voluntarily request that their benefits end, if they permanently move to another state, if they become incarcerated, or if they pass away. Those are the situations where someone may lose their OHP coverage, their public medical coverage in Oregon. Any other reason, such as not responding to a request for information, going over income, things like that, they will not lose their coverage. We also have limited the number of folks who reduce their level of benefits. So most OHP members who would normally see a reduction in benefits will keep their higher level of benefit through this emergency period. We're going to go into some exceptions to show you what that might look like though, and then circle back to what it looks like to not reduce. So there's very specific categories of folks who may see a reduction in their benefits. Minors, so coverall kids minors who are turning 19 will reduce from OHP Plus to the CAWM emergency only level of coverage the month after their 19th birthday. That includes if they are within that 138% of the federal poverty level that we would expect for CAWM, and also if they were covered up to that 305% because they were children. So as they turn 19, they will switch to CAWM instead of staying on OHP Plus. That's the same for OHP child members turning 19 who do not have an eligible immigration status. They'll have that same scenario happen. So for instance, that might be someone who is a LPR of less than 5 years. As a child, there is no 5-year bar, but as an adult there is, so that could reduce someone to CAWM, just to give you an example of that type of situation. And then the last possibility is if someone is a non-citizen adult, they were initially approved for OHP Plus, but once their immigration status was verified, it was found that they do not have an eligible immigration status. Because that's something called a soft pen, some folks may get full coverage and then it has to be reevaluated. At that point, they would reduce to CAWM level benefits. So now that we've talked about the only categories we know of who may reduce benefits, let's talk about a key category of folks who will not reduce benefits, which is if someone is on CAWM Plus which means they would be generally eligible for CALM level benefits, but they are pregnant or have been pregnant in the last 60 days. That level of benefits will stay even once those 60 days have ended. So if someone has, say, given birth, and normally 2 months later they would revert to CALM, they will stay on CALM Plus, which really mirrors that full OHP Plus level of benefits throughout this emergency period. That means that they'll have access to expanded vision and dental care, and everything that would normally be associated with CALM Plus just continues to be in play. Once again, this is a little weedy, but we want to help you understand sort of the ins and outs of what to expect so that if you do see people who are reducing benefits or losing benefits who don't fall into the categories we talked about, we know to bring that to the one customer service center and to see what we can do to make sure no one is closing or reducing in error. And then also you should see fewer requests for information, fewer pens during this emergency period. We do want to let you know most income will be accepted as attested on the application and will not generate a PEND or a request for information, but sometimes additional proof may be requested if there is missing information or if there is contradictory information in our databases. So you'll still see requests for information or RFIs for immigration status, citizenship. I would say the most common missing information you're going to see is social security number. That's technically considered a missing information pen in most situations. If there's something we need on the application we don't have, that'll still be pended. But for most income, that will not be the case. And I think, Deanna, would you like to take it from here and I can click through for you? Would that be easiest?
Sounds good. Absolutely. Thank you.
All right. Thank you.
All right, so we're going to talk about income, which is always feels weedy for some reason, but we recognize that during this COVID-19 emergency period, there are different types of income that people are getting. So we wanted to provide some guidance on that. Also, with the integrated eligibility system, there are more specifics and clarifications about what types of income get reported. So I think it's a good reminder that reporting income is a more robust portion of the application these days. So some examples of income are pandemic unemployment. People might be getting gifts either from family members or from organizations. They might be getting loans to pay for them some of their expenses. There are stimulus checks, there are emergency relief funds, etc. Like the first thing that I want to say, which is an overarching guidance, is that all income must report it. It must be reported, and it might count for some programs and it might not count for other programs, but that's not for us to determine because we as community partners and ROCs are not eligibility workers. So our role is to make sure that all income gets reported. And then the one IE system determines which income counts for which programs. Much of the COVID-19 related payments are going to fall in the unearned income category. And we are in the process of preparing a guide for you. There are still some outstanding questions and we're trying to finalize that. So what we will do is, as soon as that guide is available, we will send it to everybody who participated in today's webinar directly, but also we will make sure it is available to the community partner network at large. But I'm not sure we have that available for you today. All right. So we first want to start with unemployment payments. So we have the federal pandemic unemployment compensation. That's the additional money that people get in addition to their existing unemployment. And it is counted for some programs and not for others. So for example, it's counted for marketplace plans. It's not counted for Magi OHP monthly income, but it is counted for OHP annual income test. So we're just giving some details there so that you understand the nuances and why it needs to be reported. So you would definitely go into the applicant portal, you would select report a change in circumstances and add that additional unearned income. And in fact, there is a specific pandemic unemployment distinction in unearned income so that you can enter it there, and you would also enter it in the annual income section. There's also PUA, or Pandemic Unemployment Assistance, and that's the new kind of monthly unemployment insurance for workers that wouldn't typically be covered under unemployment, people like gig workers, self-employed, etc. And that unemployment assistance is treated just like the normal unemployment assistance, and it is counted in all of the OHP income tests. It just gets entered as unearned income unemployment. It doesn't get a separate distinction, but you do also need to add it into the annual income reporting section. The third type of unemployment is regular unemployment, and that includes extensions on the unemployment compensation claim. So right now, people can get unemployment for a longer period of time, and all of that must be reported, again, under unearned income unemployment and in the annual income. And the next slide, we have some screenshots for you. So you'll see that the unearned income has an unemployment section, and that's what it looks like. And if you select unemployment, it will ask for what type. It's either regular unemployment, which would be the base amount, whether you're getting it because you were employed by an employer or because you are self-employed or a gig worker and now you're getting that extra. That would be unemployment compensation. The pandemic unemployment is the extra that people get on top of their base unemployment insurance payments. In the annual income test summary, it says, okay, here we go. There it is. Unearned income. So we ask for it separately. And the reason is that sometimes it might get counted toward one program or not counted toward another program. So we do want to separate it out so we can make sure it is distinct. So that's what it looks like in the screens in the applicant portal. All right, now we're going to talk about renewals. And just a reminder that if you have questions, you can type them into the questions box, and we will answer them at the end. So most renewals continue to be what we call passive or auto renewals, but they're still happening. And that is the important message here, is renewals are still happening on the usual timeline. When people come up for renewal, they will be under renewal. Now, because we are not pending for proof of income right now in most situations, there are more renewals that are going to go through without a hitch, without further information being needed from the client, such as renewed proof of income. So a lot of renewals might seem to happen automatically. And it's simply because we're not pending for proof of income. It makes it a lot easier for clients right now. But what will happen is each member will be sent a case summary, and it is still their responsibility to look at that case summary and see if anything's incorrect. And if anything does not match up with their current situation, they must update their case. Now, because we are not closing benefits for most reasons, reporting updates will not cause a member to lose benefits or for their coverage to reduce, except in those scenarios that we mentioned earlier. But they still must report. So we want to make sure that everybody knows renewals are still happening. Members still must report any differences from their case summary, and their benefits are unlikely to close except for some specific scenarios. Now, some people may still have active renewals, and they do require a response. If they have an active renewal and they're on non-magi, they may have to do an interview in order to continue their benefits. So watch out for renewals, help clients know what actions they need to take, but also let them know that their benefits are very unlikely to close. All right, now we're going to move on to reporting changes. It's always good these days to have a reminder for our whole network that changes still need to be reported within 10 days. That is still the case. So hopefully every single person that you're helping apply or every single person that you're helping report changes, you provide this reminder, and changes should be reported as usual, even though reporting a change will likely not cause a member to lose coverage. They still need to be reported. When they sign their application, they're signing to reporting changes within 10 days. So thank you for continuing to spread that word and make sure that you're assisting clients with that as necessary. One of the other changes that we are experiencing during the COVID-19 emergency period when it comes to access to health coverage is that telehealth is available at no cost to OHP members in many, many cases. For a lot of people, that is opening up the opportunity to see doctors without traveling, and it might make it easier for them. They can talk using phone, video, or various online methods to talk to providers directly, and that really depends on the provider and what platform they use. If OHP members would like to make a telehealth appointment, they should ask their provider if that's available if it isn't initially offered. But also a reminder that they need to request an interpreter for those appointments if they need an interpreter. And those interpreters need to be requested beforehand so that they can be set up and provided during the appointment. And I'm waiting for the next slide. There we go. Actually, we have a new update about interpretation service for open card members. So I'll put a little plug in for that. You can look on group site, and it's not part of our topic today. But what is on our topic today is guides. So we have a few guides for you. One of them is assisting with OHP remotely, and that is an updated guide for everything you need to assist somebody remotely over the phone, or you can even do a video appointment, but it's without seeing each other in person. So it's how to collect verbal consent, and then how to help a client with that application signature, even when they are not physically present with you. You can now do all of that remotely, and we have provided updated guidance. We have an unemployment income guide during COVID-19, and that is an income guide that we are working on finalizing right now. Like I said earlier, we will send it to people who have attended this live webinar, and we will post it to group site and share it through other avenues as it is ready. And then we have the presumptive eligibility temporary COVID-19 guidelines, and that's what Jessica was talking about earlier, that during the COVID emergency period, we've opened up presumptive eligibility to all certified community partners. You have to take a training, and it guides you through how to do that, but we want many tools to be available to make sure people are getting coverage when they need it. So if your normal methods for helping somebody apply quickly are not working for some reason, presumptive eligibility is a tool in your back pocket that you can use if you've been certified to do that. Now, as we know, we live in a changing world. So this guidance will likely continue to evolve. What we'd like to ask all of you to do is to keep an eye on group site, especially the COVID-19 discussion section and the announcement section. Whenever we send a CP update, we really try to make sure that we are putting relevant information in there. So watch out for your CP updates and definitely read them. It's not a fluffy newsletter, it's critical information. And of course, attend your regional collaboratives, because as these guidelines are updated, we will be sharing them out in various ways. So whatever you're hearing today may not be the case as things evolve. So keep your eye out. We also have the OHP and COVID-19 public site, which is a great resource for information. So we put a link there. Keep an eye out there, and there are links to other resources as well. And of course, you can always email community.outreach. That's our community partner outreach team group email. You can go to group site and watch group site for announcements. And a reminder that if you need training resources or other materials in alternate formats or other languages, please just ask us. And you can do that again at our team email, community.outreach, and we will work to accommodate those requests as needed. We do have quite a few COVID-19 listening sessions that we have been facilitating. So you can check out the group site calendar, and look for these COVID-19 feedback and listening opportunities for migrant seasonal farm workers. There are a few that are just regionally based. We offer them in English and Spanish. And as time goes on, we have more of these sessions. So if you have input for the agency, that is a great place to provide it, because the input from those listening sessions goes directly to leadership. So we really want to encourage you all to attend. And we also, here are some links to some of those community engagement listening sessions so that you can attend them if you would like to, and we really do encourage it. We'd like to move now into the questions section of our webinar. And so what I will ask Jessica to do, and myself, I will also help, is we'll pull up the questions box and we will see what's in here that we can start to answer. So thank you for listening, and let's see what kinds of questions we have.
Thank you so much, Deanna, and thank you. I know it's always a little bit harder when someone else is driving the slide deck you are trying to talk about. So you rolled with that very well. Thank you.
All good.
Let's see here.
All right. I'm looking through the questions as well. A copy of today's slides. Because we've been reporting, we're not able to upload documents, but we will send a copy of this presentation and the remote assistance guide to everybody who has attended today's webinar. So watch your email for that.
And also it will go up on group site as well. So you can direct yourself and your colleagues there as well. I do want to acknowledge that the reporting changes within 10 days is fairly new guidance. So there may be some places where it still directs folks to report changes within 30 days, but it has been changed in rule and operationally now. The expectation is 10 days to report a change.
All right, and a good guidance for everybody, if you're wondering, well, in this situation, if this person is getting this kind of income, should it be reported? The answer is yes. All income really needs to be reported. And for some of the traditional, like what you're used to, the Magi OHP, many of those types of incomes will not be counted, but they still must be reported. And a little reminder, if we think back to the OHP application on the One System, when people look for unearned income, there are examples such as collecting bottles and cans and turning them in for money, street performing, collecting mushrooms and moss in the forest and selling them. Those are all, even donating plasma, those are all considered types of income that need to be reported. In addition to that, there is a section for gifts that need to be reported. So all income, any money coming in, it's not just earned income, right? But any money coming in gets reported.
And I would say just because something doesn't count for one program doesn't mean it won't count for another. So there may be non-medical or Magi versus non-Magi programs that folks are being considered for, that we really do want to have that more complete and accurate view of, who a household is, what their income is, if you're asked for resources, what those resources are.
And if you are reporting, sorry,
go ahead.
If you are reporting a change in income, you can do it through your normal means of client advocacy. So you have the email teams if you're a certified community partner. You do need to have a consent form from a client in order to be reporting a change for them. So a reminder about that. And you can also call on the phone and report a change over the phone, again, as long as you are attached to a client with a consent form.
And I will also go ahead and say, like, that distinction between 10 days, 30 days, 6 months later, the sooner someone gets their information in, the better. There is always the possibility that they may be asked to repay benefits. There may be penalties if folks do not report timely. I'm imagining at this point, there's not going to be a lot of difference between 10 and 30 days as we get used to this new situation, but that the sooner someone gets their information to the state, and if you're a community partner and someone has information to get to you, it is also your responsibility to get it to the state timely. That's what's going to serve folks best, so that they don't have to repay, for instance, their capitation fee that goes to the CCOs every month, or more intensive things than that. We really want to do what we can to protect folks from those potential legal implications and the overpayment group that they might have to work with.
Yep, and that is the term is overpayments. If you ever hear the term overpayments, that refers to a client having to pay back the cost of their health coverage during a time when they were not actually eligible um, because of a problem that was created from their information. Not when it's the state's fault, but when it's the client's fault.
I see a few questions that I want to acknowledge, even though we don't have answers today, which is any details about what particular types of tests or types of treatment fall under the covered services for COVID-19 or not. We're not experts on that, so we can't speak to that intelligently, but know that there are resources. And I'd like to offer as the provider coordinator, if any of you want to email me with specifics or situations you're looking to get more information on, I'm happy to chase that and find the subject matter experts within OHA. So I'm going to offer that in lieu of being able to offer an answer to your question today, Shannon. And I also want to mention that CCO changes is a whole different topic that we want to give its time and energy to. So I do know that that is on our docket for a module in the near future, I believe. So instead of trying to go into it now unprepared, we want to get you good resources soon.
Big topic though, great questions about
These are all
CCO changes.
great questions.
Absolutely. What I would like to say, and I'm sorry, I was actually trying to answer something here. If even if Jessica said it, I think it's worth reiterating. If you have any questions about what might be covered for an OHP client, the client services unit is the place to call to, well, first, if they're enrolled in a CCO, you would call the CCO to see if that antibody test or whatever the thing is that you're asking about is covered. And for anybody who's on open card, the client services unit is a place where a client can call and a provider can call the provider services unit to check out coverage.
And we can help make connections, but those are not within our scope of work. So we don't do that level of detail, but we're happy to help however we can. But just know we also don't want to be in the middle of something where you may be able to reach out to those experts directly.
We wish we knew everything.
Yeah, I'm trying.
But we don't. Doing a pretty good job, actually.
Looks like it has quieted down in the questions box.
I do have a question that somebody asked that I want to state for everybody in case they weren't watching the questions box, because I think it's important. The question is, can Calum clients get an interpreter? The answer is yes. All clients on OHP have a right to interpreter for navigating either navigating or seeing a doctor. So they just need to request it beforehand, so that can be lined up. Yes.
And that's a requirement to providers. Providers must offer this as part of CMS guidance.
So please make sure your clients know that. You want clients to get interpreters when they are seeing a provider, so they can make sure to have a good appointment.
And if you are concerned about providing interpretation for the OHP application process or advocacy, know that we do have tools as well, and I highly recommend you follow up with your ROC to get those details.
So a little clarification, providers are required to provide interpretation services for all OHP covered services at OHP covered providers. And if you have any questions about what might be covered for your CCO member, you can call the CCO directly to ask about that. But what you should hear is that all COVID testing, treatment, and visits are covered under OHP for both full OHP members and Calum emergency only members.
I do want to add one tiny caveat for this, which is that it's all covered if it is something that a physician is ordering. If someone is trying to get a test on their own or treatment on their own without medical guidance, that it gets into iffy situations. So I don't want to promise everything. And so there are some distinctions about like antibody tests and in what scenarios. But if a doctor is asking you to be tested, is requesting, has approved that, then it should be covered more or less. And I am simplifying. I don't, because we can't go into the nitty gritty because we don't know that level of detail. But that is for all OHP members, for all COWA members, whether someone has an eligible immigration status or any immigration status or not. I think I saw a couple questions to that
Yep, but I
effect.
think you covered them. It's for OHP members, regardless of their level of coverage,
And also, we're not
as
experts
ordered by a
in
physician.
private medical coverage or other things like that. So I don't want to talk about something I can't speak intelligently about, but you could check in with, for instance, the Oregon Health Insurance Marketplace if you have questions about qualified health plans, or with private insurance providers themselves if you want to really get into the weeds on that with them.
All right. I think we've dialed down on questions. So
Yeah.
I'm going to call it and say thank you, everybody, for attending. If you have any further questions, you can always reach out to community.outreach or directly to your regional outreach coordinator. And we just want to put out a heartfelt thank you for everything you are doing to help your clients. We know it is tremendous work. It's so important. We are honored to be here to support you in that work. And thank you for everything you do.
So well said, Deanna. Thank you all for being here. Really awesome to see really engaged and a large crowd on our first module of 2021. We look forward to continuing to get these resources out to you. Thank you so much.